Hello everyone, I am urologist Omer Erdamakaya. The subject I will talk about today is the problem of testicular atrophy during testosterone treatment. Of course, depending on the duration of testosterone treatment and the amount of testosterone used, atrophy occurs in the testicles over a certain period of time, usually months. This is more severe in anabolic users, because higher doses of anabolic substances are used. The pituitary gland is suppressed much more severely. LH is almost zeroed out. The reason for the testicular atrophy is that the pituitary gland does not secrete LH and FSH hormones. When we give long-term marathon testosterone therapy to patients, we use a drug that creates a human gonadotropin effect, that is, a drug that creates an LH effect, such as Ovitrel or Pregnil. For example, when you inject Ovitrel once a month, it can reduce or stop atrophy in the testicles. What advantage does this give you? This can speed up the testicular rehabilitation, and the reactivation of the testicles a little bit more after stopping testosterone therapy. Because it helps to keep the Leydig cells in the testicles a little bit more alive. Is another drug, for example Clomid, an alternative to this? Unfortunately, friends, it is not an alternative to this. Clomid is a hormone that secretes LH and FS from the pituitary, but when the body is under high testosterone or anabolic substance pressure, it is very difficult to make the pituitary secrete LH with Clomid given externally, or even if it does, it will secrete very low amounts. So it is not correct to expect Clomid to prevent testicular atrophy. The only medication currently used is Ovitrel. Other drugs are not used. This may sound complicated, but if you are curious, many videos on my channel explain anabolic steroids in much more detail. If you watch those videos, you will understand these issues better. Thank you for listening, best regards.